That's really hard to narrow down because basically anything that you can treat with your hands, you can use the instruments to augment that treatment. So as part of an orthopedic clinical practice, I can't see really practicing without the instruments.
I would say typically the more primary soft tissue dysfunctions, tendinopathies, ligament injuries, especially the more superficial lesions, Achilles tendinopathy, plantar fasciosis, those sorts of conditions.
My clinical practice primarily includes lower extremity biomechanical type issues. So I would say the Graston technique got my attention when my plantar fasciosis outcomes went from about 35% to 85%. I will use it with any soft tissue issue, but probably anything involving the foot and ankle, IT band, hamstring tendinopathy, GT is my go-to technique.
Probably the most common I run into is plantar fasciitis or fibromatosis, whatever the doctor wants to call it. Really, really good results. Nothing's ever worked better than the Graston technique on that.
Well, I treat a lot of runners in my practice, and so I get a lot of patients who have IT band problems that they've just really suffered with, and so I get a lot of great results with that, and also with plantar fasciitis, because that's such a frustrating condition for so many people. So I see a ton of that in my practice, and it's great because these people have tried everything, and they come to you, and if they've never had Graston technique, they get such immediate results that then they're fans for life.
Pretty much everything. Post-surgery, scar tissue, tendinitis, overuse. It pretty much can serve the abundance of all injuries. If you use it correctly, it can be very helpful when you get your athletes back to competition a lot sooner.